Hey guys, good evening. I'm super excited to come live again tonight. We've got a great topic for you guys, going over some stuff about hormones and thyroid. Dr. Rebecca has really been on this major kick lately of how to balance hormones. She actually just got done doing a Facebook Live. That was yesterday? Last night? Last night?
Yeah.
Yeah, I think so. On looking at something like PCOS, right? And so looking at polycystic ovarian syndrome and again its rise and looking at really what causes that and everything. So if you didn't catch that, make sure that you go back and watch that. Again, it should be towards the top of the page so that you can get some information on that. That was really one that I think hit home. With a lot of people,
yeah.
So it's a diagnosis that we're seeing on the rise, pretty big, and again we're going to go over some of those things tonight. As far as like hormone balance, really what you think is normal is not. Even what your medical doctor tells you is normal is not. What are some of the primary causes of hormone balance, and what you can start doing now to again start regaining that process. And I will say it is a process when it comes to hormones, guys. It's I think you even say with your thyroid patients that at least give it 6 months, at least,
if that,
right?
Just to get started.
Just to get going. So it takes some time. So hang in there. Any questions you have, make sure you ask so we can answer all those for you guys, okay?
Coaching them to the future and empowering them to live to their fullest potential. Find Drs. Warren at drswarren.com or like them on Facebook at Drs. Warren.
Good evening. Welcome to The Wellness Radio. We are here live. My name is Dr. Rebecca Warren, and I am here with my co-host and handsome partner in life and in business.
Nice.
And in raising. You act like I don't say anything nice about you ever.
It's about time. I
No,
feel like it's like,
thanks for the compliment.
yeah, vindication here. I feel like it's
Anyways.
finally getting the credit I deserve, right?
What? I
It's gonna
just said you were like, what did I say? You were nice or something?
Yeah, I'll take it, man. I'll take it.
Anyways, this is the Wellness Radio. If this is y'all's first time tuning in, we are here every Saturday morning from 10 to 11. And we are here every Tuesday from 7 to 8 when there is no basketball. So, yeah, now I have more reasons for why I'm happy that Tennessee isn't playing tonight. So, we get to come here.
You just lost like half
I
the
know.
listeners.
My
They're
bad,
like,
guys.
not going to listen to this.
So we're excited to be back, and so I think there's one more game that might interrupt our regular scheduling of us being here on Tuesday nights, but we're so excited. We're going to be here regular. And so, we have a health center here in Hamilton Place. We're located right across from the YMCA and next to the Home Depot. And so every Saturday morning, we try to touch on different topics that's in the news. We try to touch on different symptoms that people struggle with. And so, one thing that comes up a lot, very, very often, is hormone issues. It's thyroid hormones, it's estrogen, menopause, perimenopause, testosterone issue. There's all of these hormone issues, and so we've decided that every Tuesday night, our Wellness Radio Tuesday night show is going to be devoted to hormones. It's going to be answering your hormone questions. We go live, so we have a Facebook page, Drs. Warren, that you can watch us live, and so you can rewatch this later on. But our purpose is to make sure that you don't end up like everyone else. I've had to tell multiple people in health consults in our office with our practice members this past week. I had to tell them, like, gone are the days of you just sitting around and doing nothing. Guess what? You don't live in the same world as your great-grandmother or grandmother that lived until she was 99, okay? Yeah, they ate pork, but their pork actually lived in their yard, not in a pent-up cement, no sunshine type of place. The truth is, what studies say right now is that if you are not actively doing something about your health, you will develop a lifestyle-related disease. And what are lifestyle-related diseases? Diabetes, cancer, heart disease, high blood pressure, high cholesterol, PCOS, hormone imbalances, low testosterone. Guess what, guys? This isn't anything that our ancestors were dying from. They were dying from falling off a cliff or a tiger coming after them. And the crazy thing is that in any other science, when people in biology zoology maybe, I don't know what they study, but if they were, there's all these endangered species lists, and the thing is this, when a species of animal is becoming sick, when a species of animal is dying off, every single scientist, and they put it in the news, they all ask why. Why, if these species of bumblebees, they were okay and now they're dying off, why is that happening? And they try to figure out why. They find what's causing them to die off, and then they fix it. And yet our species of animal, we start to die off. We start to develop these diseases and cancers that are not normal for our human race. We start to develop really severe diabetes. We start to develop all these hormone issues. And instead of saying why, we say, it's okay, we got a pill for that. Oh, you have hormone issues, menopause issues? I got some fake estrogen and some fake progesterone for you. Oh, men, you're struggling with testosterone. Let's not talk about the fact that you're taking a statin medication that will completely wreck your sex hormones. Let's not talk about how heart issues are also related to that. Let's just go ahead and inject you with fake testosterone and keep you needing it over and over and over again. Men and women that are struggling with thyroid issues, oh, you have a thyroid problem? Your body's not making thyroid hormones? Yeah, let's just bypass your body. Let's forget about the fact that your body isn't doing it, and let's just give it to you in a pill form. And that's why we're at where we're at.
Yeah, no doubt. I mean, again, when you look at our us as a civilization right now, United States just completed, what was it, the 4th year in a row of life expectancy going down. So when you have a combination of a couple things, when you have a combination of life expectancy that's gone down over the last 4 years, and then you combine that with the 39th ranked in the world infant mortality rate, you have a serious problem. You have a dying culture. That's exactly what it is. And so yet we're spending billions of dollars, right, on what we call healthcare. And really, what's really funny is when we look at the literature, the only things that are really working in our medical field are the things that they're mimicking nature with. Right? Like, we just came across a new article that was like, what do they call it? Biopharmacy, like biopharmaceuticals, where they're going to try to mimic the microbiome and mimic, like, our bacterial interaction and everything. And it's like, dude, holy crap. Like, at what point are we going to wake up and realize, like, stop relying on your doctor and your drugs and again, your surgeries, and start actually taking care of the problem, right? You've got to take care of that problem. If you're not taking care of the problem, then bottom line is you're going to end up like everybody else, right? What was a pastor used to say? He used to say, if you want something different, you got to do something different. And again, that used to stick with me so much because we don't always think that way, right? We say, what can I do to cover up this problem? What can I do to mask this problem? And bottom line is you're not going to get well until you get down to the cause. A lot of times patients will come in and say, well, you know what? I heard you on the radio, I heard you on, online, I heard you on Facebook, whatever it was. And they're like, I don't know what it is. Something about you guys are just different. What makes us unique is that we ask the question, why? What makes us unique is that we say, hey, you know what? I really could care less about the symptom that I see. What I want to see is what is the underlying cause to that symptom so that I can actually get to the root problem. And that's how you get people well. And what's really encouraging about this is that regardless of what you're trying to either prevent or what symptom you're trying to get rid of, the next time you hear that it's all in your genes, you might as well just, again, disregard whatever information is coming next. Because we even know when it comes to cancer, right, even some of these, genetic predispositions, this is a subject Dr. Beck and I have been diving more into. It's not that, again, your ancestors just gave you these terrible genes. It's that, again, you may have a predisposition, but it's the environment that you create both internally and externally that is going to turn on that gene or turn off that gene. So stop, relying on the excuse that, sorry, man, there's nothing I can do. It just runs in my family. That's bullcrap, right? You have a choice. You can actually choose when you wake up in the morning that says, you know what, I'm going to take the necessary steps to move closer to, health and wellness, or I'm going to take the steps back, right, and move more towards like disease treatment. And again, we all know how that's going right now for most people.
So today we're going to be talking about hormones. So what are some of the hormone issues that we see that come into our office? I want to touch on thyroid and PCOS. And so the crazy thing is PCOS, endometriosis, heavy periods, painful periods. The problem is this. if you're listening right now, you have a loved one, you're like, man, they really need to hear this, or you're driving your car and you're like, man, I want to hear this. You guys, if you can't listen to the whole show, find us on Facebook at Doctors Warren, DRSWARREN, and we're recording this because the problem is with thyroid and PCOS issues, if it never gets corrected, it doesn't just go away. As you age, even if you go through menopause, you're still going to have the problem that caused your PCOS, and you're just going to have an issue going through menopause and what's going to happen with you after menopause. Another thing that we're going to touch on this next hour, or 45 minutes left in the show, is we're going to talk about testosterone. Men, okay, yes, naturally it'll come down as you age, but at the levels that we're seeing nowadays, this is an epidemic. This isn't just about you not being well. This isn't just about how it's setting you up for failure in your own body, for sickness and disease and early death, but we're also talking about the way that you feel, your ability to perform, your ability to feel like yourself, to feel like a leader in your home, or to feel like you can work hard throughout your day. Not only is this going to be a physical issue, but this is going to be a mental wellness issue. So we're going to be talking about thyroid, PCOS. We're going to talk about estrogen dominance, because guess what? If you have a testosterone issue, you have an estrogen issue. Men, you have an estrogen issue, and we're going to talk about why. And women, if you have an estrogen and progesterone issue, you have a testosterone issue. And anyone that has a hormone issue, you have a metabolic issue. You have cellular inflammation.
Preach it.
Yeah, thank you.
Yeah, but again, I think these are things that are not, I think we're starting to get it more into the mainstream. But again, this is still, most people don't recognize that PCOS has anything to do with a metabolic issue inside the body.
And what does that mean? It means insulin, it means blood sugar, it means digesting and absorbing foods correctly. That goes for even testosterone issues. So I know we're about to go on a break here. This is the Wellness Radio. Guys, find us on Facebook. Make sure you like us. You can watch us live there. Come back and watch it on Facebook, Doctors Warren. And when we come back from the break, we're going to talk about thyroid and PCOS and testosterone. So you'll definitely want to tune in.
Awesome. Wellness Radio will be right back after the break.
All right. So we have people tuning in here on Facebook Live. We're so excited to be doing this, and I think we're going to talk about hormones a lot more. To be completely honest, I did a video on PCOS on thyroid last night, and Dr. Nathan didn't even know I was really going to do it, but I was getting frustrated by two things. Number one, I was getting frustrated, I was getting angry that woman after woman that I was seeing in the office and that I was getting on virtually to coach, I kept hearing about these heavy periods, these horrible cycles, these fertility issues that most of them didn't even know what to do with, and a majority of them went to their doctor, and their doctor just gave them birth control. And it was just ticking me off. Like, I was just getting pissed off. And then I went to the literature, I went into research, and I was looking at how toxins and foods that you eat are going to cause things like PCOS. And so I got on, I did a Facebook Live, because the answer again is to medicate. And then when you want to get pregnant, it's to get pregnant artificially, go to a fertility clinic, pay a ton of money to get pregnant, and you hope that it works. What if we could change all of that? What if we can teach young girls what it means to be well with their hormones, so that when these young girls want to have babies, they're able to have babies and be well and not have to invest thousands and thousands of dollars, and those same women can grow to be older and go through menopause without crazy hot flashes and depression and anxiety and needing synthetic hormones. This is all connected.
Yeah, no doubt. And I think, too, what you have to recognize is behind all of that, like, we understand that there's a time and a place for, things like some of the modern, treatments that we have for fertility, when it's like there's nothing else and they've tried all these other avenues. But bottom line is this: what we're finding is the people that come into our clinic, there's a lot of heartache behind this. Even some of the women that have suffered, I can't tell you, I would say, maybe 6 out of 10 women that come in that are over the age of 40 have already either had a full hysterectomy or a partial hysterectomy.
Yeah.
I mean, I'm seeing that it's almost a guarantee nowadays. Even women who've been trying to quote unquote take care of their health, right? And so
and the crazy
it's a
thing
lot
is
of heartache
this,
behind
though.
these
The
things.
crazy thing is, you have a hormone issue, and the answer is cut out your organ.
Yeah.
You know, there's got to be more to that. We're about to go live here on the radio. Let us know if you guys have any questions.
That's 267-1023.
All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren. And so we've been going over, basically what the state of our healthcare system is, right? And now we want to dive into what the topic of our show is, and that's dealing with hormone balance, right? So this is dealing with, especially like you said, men, right, with testosterone issues, women with things like PCOS, which are seeing a rise in. But I think you also got to throw in thyroid because again, thyroid's kind of connected there with really both of those, diagnoses. So, I think one thing that is very, very true about all of those that I just stated on Facebook Live is that there is a lot of heartache behind those type of imbalances. I mean, for example, we know that if your testosterone levels are lower, you're at a greater risk of things like depression, right? You're at a greater risk of, suffering with things like anxiety.
Whether you get injected with it or not.
That's exactly right. Because just because it increases your blood levels of testosterone still does not mean that your cells are actually getting an uptake of that testosterone and utilizing the way you should. So that's why you can actually get injections done and still feel like crap. And then shortly after, if you don't continue those forever, again, you'll see not only a decline back to the levels you were, you actually see it dip even lower because of aging, right?
Yeah,
So
absolutely.
Yeah.
And so, the first thing we're going to touch on, thyroid hormones and PCOS, because I have someone come in and I literally, before they can say anything to me and they tell me they've had thyroid issues, I'll go, okay, I know you're coming in here with thyroid issues, but this is the other things that I see. I see thyroid issues, I see PCOS, endometriosis, some type of estrogen heavy period problem. I see digestive issues, I see gallbladder issues, and I see some anxiety, some depression. And anytime I say that to someone before they start speaking, they look at me as if, whoa, like for the first time ever, a doctor knows exactly what I'm going through before me even having to go into it. And the reason why these problems are showing up all together, plain and simple, is because your body's not getting well.
Yeah.
So you have a disease that has developed. You have a symptom showing you that the body's not well. And so your thyroid stops functioning. Your doctor says, hey, you're not making enough hormone. Now I'm going to get you on Synthroid. But guess what? All Synthroid is doing is giving you the hormone. So it's the equivalent of you having a hole in your gas tank and you go to a mechanic and you say, hey, my gas is leaking out. And the mechanic says, I have an answer for you. The answer is just fill up your gas tank more often. That is what you're doing when you take thyroid hormones. Your thyroid is not well, and instead of trying to figure out why the thyroid is not well, then you just put the hormone in. Well, the same things that cause the thyroid to be dysfunctional are going to cause the same thing with your sex hormones. And so studies have found that antibody levels, meaning autoimmune levels of two different thyroid antibodies, when those are high, it will influence, they're trying to find a relationship between the two, but they say when those antibodies are high, your sex hormone will be out of whack. And the thing is this, I don't care if your OBGYN or your doctor told you you have a progesterone issue. No. You have a progesterone, testosterone, estrogen issue.
Yeah.
You have a hormone issue, which is also tied in with thyroid and insulin and all of these things. And so when your progesterone is off, you can bet that your estrogen is off. So people with PCOS, I know a lot of you guys are being told that you have a high testosterone. Really, you have an estrogen issue.
Yeah.
So you have a lot of things that you're exposed to that mimic estrogen, so your estrogen levels go high, and then you react to it, and it affects your insulin and blood sugar as well.
Yeah, I mean, you can't mess with one hormone without
Absolutely
the others.
not.
I mean, again, guys, you have negative feedback loops in the body. Like, you can't possibly mess with one hormone and not expect it to mess with other ones. Like, it's just something that you got to recognize. So that means when you're throwing something like, again, Synthroid into the body, again, expect it's going to have an effect somewhere else because you are artificially stimulating that. And again, I think that there's a major, disconnect here where we talk about throwing hormones in, but what the general public doesn't get and that their doctors don't explain to them, maybe even, most of their doctors don't get, is you can throw a ton of hormone into the body, but it still doesn't mean you're going to utilize any of it, right? Like, and that's one thing we're going to go over here in a little bit is, that's why we talk about healing the cell, because if you don't ever heal the cell, specifically the cell membrane, it doesn't matter how many you throw at it because the receptors are not going to grab onto that hormone. So how many people do you see like that? It's sometimes it's like I feel bad for her, especially after like a Thursday, a really busy day for her. You're like consult after consult after consult, and it's almost like the same story of like this doctor is just throwing a ton of hormones, and it seems like they're just throwing more and more at it, and yet they're just creating more chaos inside of the body. It's never actually fully getting in.
And can I say something? Men and women that are listening to this, if you don't feel well, then you are not well. I don't care what a doctor told you. I don't care if they're from Vanderbilt. You live in your stinking body every single day. And you should not wait for a doctor to have to tell you, oh yeah, you feel bad, it's because you are bad. No.
But you see your blood work, like you look good. No, don't tell me you feel bad. I know you don't. I'm looking at your blood work.
No, this is what you've got to understand. If you feel like something is off, that means then you're not going to the right practitioner that knows how to recognize that and help get you well. So if you're feeling like something is off, if you're struggling with depression and anxiety, if you've had lab tests and they're telling you that you're fine, I'm here to tell you they're wrong, and you need to see someone like us. And so I do want to take a moment. I know we're not here. Usually we haven't been here in the last few weeks. So if this is your first time tuning in, we are the Wellness Radio here every Tuesday evening, 7 to 8, Saturday morning, 10 to 11. And if you're hearing this and you're like, man, I want help like this, good news, we are local here in Chattanooga. We're located in Hamilton Place. And we do virtual health coaching all over the U.S. So if you're struggling with any type of hormone issue, whether it's thyroid, testosterone, prostate levels, insulin, glucose issues, or even if you don't feel well and the doctor is telling you everything is well, we want to let you guys know we are here. This is why we do this. And so every radio show, we tell our team to set apart 2 to 3 appointments. I think today we have 3 appointments. I told Mary Beth, 3 slots. So you guys can give us a call and set up an appointment to sit down with us. What it looks like is this is an information gathering appointment. This will be the first time where a doctor sits down with you and talks to you about what is causing the issue, the why behind you're here. And we'll do tests according to what you have going on. So if you want that help, you can give us a call. That number is 423-362-5360. Again, that's 423-362-5360. What?
Yeah, you got
5360 362-5360. And find us on Facebook. There's a lot of great information and videos there. Dr. Warren, DRSWARREN.
All right, guys, we'll be right back after the break, and when we get back, we're going to dive some more into PCOS, thyroid issues, testosterone, and again, give you guys some solutions as well. This is Wellness Radio. Be right back after the break. All right, guys, so this is one, again, you can tell this is, I feel like for Dr. Rebecca, it's almost like a broken record player, right, that plays over and over again. And this is why she's so passionate about it because, along with some of these hormone deficiencies comes a lot of heartbreak behind that. And again, you can see amazing results when you start to actually get down to the cause of hormone imbalance, right? And so let's kind of dive into a couple of these things. I think when you were talking about, dealing with looking at like the antibody levels, can you explain what are some of the most common things that you see raise those antibody levels?
Okay, so gut permeability is going to raise your thyroid antibody numbers. So looking at stuff like gluten products, processed products, a lot of antibiotic use, a lot of things that are destructive to the gut, bad fats, And again, I'm going to say a lot of antibiotic use.
Well,
you're going to raise up antibody numbers.
Yeah, I mean, we even know studies show like even one use of antibiotics can change your gut forever, right? So that being said, like, you know, almost all of us have used antibiotics at some point in our life, unless you're a parent listening to this and you've been taking, you know, great care of your kids and building their health up, you know, but the rest of us, you know I used antibiotics, you know, almost over and over again as a kid, like just like cyclic all the time. And so again, I know that's why it took me years really to reestablish a new gut, right? And there's certain steps to do that, and we'll dive into it. But again, leaky gut, that's a major one. And again, I think antibiotics are a big one. But you know what? Another one is glyphosate in that exposure.
Herbicide.
So if you're not buying organic foods, your exposure to glyphosate is high. I don't care, you know, where you're from, because glyphosate in itself, it's even worse than antibiotics, because not only does, like, antibiotics wipe out all bacteria, right? Well, glyphosate, basically it wipes out all good bacteria and leaves pathogenic bacteria. So guess what? It's like literally if antibiotics are like a bonfire, you know, you look at like glyphosate is like an atomic bomb, right? So bottom line is that's going to be a major area of gut dysfunction.
And I think that as well is going to work into PCOS. And so heavy periods, I think one thing that people have to understand, and you know, when I was in chiropractic school, when I was starting to learn about how the human body works, I'll never forget my really good friend Cammie from school. She was telling me that she was having cycle issues, and I remember reading in the research about maybe estrogen being an issue with having really painful cycles. And so I told her to stop eating meat and dairy leading up to her cycle and increase her fat. And I remember her coming back and saying, oh my gosh, like I have no pain, no bad cramping, no anything. And even then, it started to develop that we have an estrogen issue. The reason why she could eliminate meat, and you don't have to eliminate meat, you need to eliminate toxins, bad toxins that mimic estrogen. And so the problem is bad estrogen levels rise, your uterine lining gets thick, and you contract really hard. They make them painful and heavy. And so we're going to dive some more into that now.
All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. I'm here with Dr. Rebecca Warren. And so we've been talking about things like hormone imbalance. We've been talking about PCOS, testosterone issues, as well as thyroid disorder, and we're going to dive a little bit deeper into those. But I know that some of you, especially on our Tuesday night show, it's been a few weeks since we've been here because of basketball and stuff. So if this is your first time tuning into our show, we all are local wellness doctors here in Chattanooga, located across from the YMCA in Hamilton Place, right next to the Home Depot. There we have a health center where we actually get down to the cause of health issues, and we want to get people well and then keep them well, right? Again, we go over things like not only do structural corrective chiropractic in our office and work on actually correcting and structure and postural changes in the spine, but then we also work with things like functional nutrition, how to get a cell well, and then cellular detoxification, how to remove things like heavy metal toxicity, things like mold, working with patients with Lyme disease, those type of things. So again, guys, we like to get down to the root cause of the health issue. So if you want our help, Mary Beth is standing by at the office. That number is 423-362-5360. Again, that's 423-362-5360. And if you're listening on Facebook Live, again, we do virtual consults as well across the country too. So again, that same number, 423-362-5360. Go ahead. PCOS. I want them to hear that, because again, it's so common.
Yes.
But what are the primary things? You were going over a couple things on Facebook Live, some of the most common things that you see that create symptoms like PCOS.
Absolutely. And so with PCOS, what you're going to be looking at is you're going to look at two different things. You're going to look at the metabolic side in regards to your insulin, because a lot of you that have PCOS are on metformin, and this is crap. This is what metformin tries to do, is artificially push like blood sugar into your cell, and it's just never going to get you well. You're just doing it to manage. And I'll go ahead and say that one of the first things that happens with people that I coach with PCOS when they start to get well and their hormones are balanced, first thing that goes away is metformin. Okay, And so one thing you have to consider is that if you are being recommended to be on metformin, if any of your blood sugar labs are off, insulin is off, one thing is to give your body a break and to cut out the carbs. And so a healthy paleo keto diet, paleo meaning eating closer to the way you were created to eat. And you guys can find more information about what it looks like to eat paleo keto by going to our Facebook page, Doctors Warren, DRSWARREN. We have videos on there. And then the second thing that I work and I coach women on is to eliminate, don't hate me, but eliminate your toxic beauty and everyday products. I shared a study about how xenoestrogens, things like BPA, BPS, phthalates, parabens, not only are absorbed into your body, and they've done studies on rats that show that they will wreck hormone development and sex hormones. But the scariest thing is that these toxins will cause PCOS and PCOS-like symptoms, and it'll create it in animals that may have never been exposed to it. Meaning they'll get it from generations before. Meaning, this is the scary thing for me, and I'm going to go ahead and say this. The scary thing is that there's women and men that are not able to get pregnant because there is a hormone issue, and it's a toxicity issue. And so what they do is they go and get fertility treatments, and so they try to bypass the problem, and so now they get pregnant with a baby in a body that's still toxic. Yeah. And we shared a video a few weeks ago, you can see it on our Facebook page, that talks about how leukemia, two things happen when a child develops leukemia. Something happens in the womb and they create a gene SNP, and we know that toxicity will cause that to children in the womb. And then the second thing that happens that sets them up for leukemia is that they don't get sick within a year of being alive. Guys, our hormone issues are creating generations of sick children that are going to turn into adults.
Yes, and sometimes that may be hard to hear, but at some point we have to have this conversation. Like, obviously as a parent, I don't want to hear that some of whether it's my choices or some of the things I've been exposed to can actually affect my kids. But bottom line is it can, and it's not an opinion, it's a fact, and we're seeing it, right? We're actually seeing that, again, when you're exposed, for example, you go through, as a young, or as a teenager or whatever, and then you go into college and you're using all these, terrible beauty products. It's,
what is it, Axe?
Yeah, Axe spray. Like, oh my God, I remember being in like junior high.
Someone's in here watching us, and I just had to ask him if he uses Axe spray.
Matt's like, no.
I mean, I kind of like the smell, but I think it's because it's screwing up my brain.
That's
I'm
exactly
like, do I like it, or is it because it's killing off my brain cells? I can't tell.
That's exactly why, right? In junior high, we would just go and like skip the shower, spray down our bodies with Axe completely. And it's like, man, thank God we didn't die. Actually, there has been cases of kids actually, being severely hurt or dying from that. But bottom line is, again, it's some of these beauty products that are out there, again, highly toxic. And so so you're using these things to look good, but at the sacrifice of your own body's health, and then later on the sacrifice of your own baby's health.
Yes,
really.
Beauty products. What are we talking about? Beauty products. We're talking about the soap you use to wash your body. How about those candles? Anything with fragrance in it, the candles that you're blowing, the air fresheners. Y'all, just let your bathroom smell like poop. Don't be spraying all those toxic chemicals or use essential oils. Yeah. I mean, it's crazy because they don't regulate it, because we're not eating it. They don't regulate. Not saying that the FDA does good.
Everybody's like, I'm never coming over to Dr. Rebecca's house. I promise our house does not smell like poop. We use things like essential oils and things like that. But there's other natural alternatives to that. But it seriously has to be part of the conversation, because every single PCOS patient that you see, that is literally the first step that you take with them. You give them a list of all these things that they need to go home and they need to check off the list. Now, do you give them permission? Should they just go ahead and finish it?
Oh my gosh, I hate that.
I just bought new conditioner, new shampoo. Shouldn't I should finish that, right?
Throw it away.
Throw it in the trash.
And men, this goes to you as well, because you've got to understand. So a building block of your hormones is going to be cholesterol. Listen to that. A building block of your hormones are cholesterol. So get this, cholesterol is not bad. It is the oxidation of cholesterol. And so what ends up happening, and I've had multiple of these conversations. I just had a conversation with this with a guy today during consult. I'm like, the problem is, oh, listen to this. I didn't tell you this. I was telling him about how even if you're on statin medication, doesn't mean you don't have plaquing that's getting worse and it's going to set you up for a heart attack.
For sure.
And so he tells me, oh, I know, my doctor said that. My doctor, when he put me on the statin medication, said, you can still have a heart attack on this, okay? And he said, okay. And he said, but you still have to take it because at least your numbers go down. What? I was like, I looked at him and like certain people in my office, I'm like, they must think I'm crazy because I'm like, what? Like, what? Okay, cool. So get on this medication. And he said it. He goes, and I love it because people that come into our office and are getting well, their mind changes. And he goes, really, you know, it's probably even for malpractice for him because if I have a heart attack and he didn't put me on statins or even offer it, then that's going to be on him. Just because you're on statin medication doesn't mean you're not going to have a heart attack.
Actually, some studies show it even increases your risk of a heart attack.
Absolutely. And so getting on statin medications is going to destroy CoQ10, which means you're making sick cells. It is a serious, serious issue to have CoQ10 depletion. But the other thing is this, you're just wiping out cholesterol, and it's the building blocks for that testosterone you need to go up. And so here you are, you're being exposed to things like that act like estrogen. If I came up to you and I said, hey, you want me to inject estrogen into your body? You'd be like, no, I want my testosterone. And yet you're being exposed to smells and foods that are literally acting like estrogen. It is like injecting estrogen into your body. So here you're on statin medications, decreasing your cholesterol, getting rid of it, and you're being exposed to things that act like estrogen. It's no wonder that so many men are now having this issue. It's not because you're broken down.
No.
It's not because you're old. It's because there is a problem and you have to get down to the cause. And so if you guys haven't sat down with a doctor that does the right labs, not just say, hey, this is your testosterone, this is your estrogen. People that say, this is 7 steps leading up to your estrogen, this is 7 steps leading up to your testosterone, this is where the problem is, this is how you get well, guys. That's what we do, both virtually all over the U.S. and in Chattanooga. We have a clinic here. And so if you're looking for help to balance your hormones, give us a call. That number is 423-362-5360. Again, that's 423-362-5360. You can set up an appointment with myself or Dr. Nathan and follow us on Facebook at Doctors Warren.
Yeah, and you can go back and watch the show. If you missed any of it, you're just now tuning in, you can always go back. Also, too, especially you women out there, again, go back and check out Dr. Rebecca's Facebook Live from, I believe it was last night, about PCOS. She really dove into some of the literature and the research behind that. But bottom line, guys, our goal with you is very simple. You know, every single one of you are meant to live to your fullest potential, right? And so what that potential is, I don't know, right? What your purpose is, what your mission is, I don't know. But I want to be the one that actually helps you to be able to accomplish that, right? And so that's what we do in our office. So again, that number is 423-362-5360, 423-362-5360. We're going to go on a short break, and when we get back, again, we're going to dive a little bit deeper and say, okay, so now here's some of the primary problems. What are some of the things that we can start looking for? Maybe some of the primary tests that can be run so that you can start getting down to the cause. This is Wellness Radio with Dr. Warren. Be right back after the break. All right, so Deborah said essential oils are great for smelly bathrooms.
I mean, I was just joking.
Yes, I agree with you.
I'm not going to let my house smell like poop, especially with a toddler that's body draining.
That is true.
I do agree. I do like essential oils. I use the thieves and the tea tree oil.
Yeah, that's right.
And whatever else is there. So,
That's
no,
right.
I agree.
Our
essential
house
oils.
doesn't smell like poop.
No.
Only sometimes.
Only when Elijah poops.
That's
and then
right.
you have to go spray.
That's right.
And
But yeah, so you can use safe alternatives. I think that's big. One that I find that this is kind of one of my pet peeves is you'll see people switch out all of their products except for which one is the big one?
What?
Hair stuff. right?
I
like
mean,
the hair
it's
stuff.
hard.
It's the
It's
biggest
hard.
one that I
Yeah.
find is that like you'll see somebody that's like, oh man, you know, even my brother-in-law. I remember a couple years ago, you go in, my brother-in-law, your brother.
Which one? I have two brothers. Oh, Isaac.
So
Are you
now
watching?
You called him out, yeah. I remember going in a couple years ago, and it's like it changed all these things, and then I see like a really toxic like hair stuff that you put in there, and I'm like, dude,
it's hard.
think about it. What you put on your skin, literally, not only does it bypass, it doesn't have to be digested. That means it goes directly to the bloodstream, directly to the liver. So it's like it bombards the lymphatic system, bombards your liver. So again, we've got to make sure that we're changing these things out. And guess what? We live in a day and age now where there's so many different companies now that again recognize that, and they take the necessary steps to utilize using some of this stuff, but again using a better.
I will say this:
brand.
if you guys are listening and you have tried new brands, go ahead and comment. I know Young Living makes really good cleaning brands.
Yeah.
I know a lot of people like to use 7th Generation. I don't like Myers because it has fragrance in it. So we use a lot of vinegar-based products, lemon-based products, stuff with oils. I know what's that brand that a lot of people Norwex?
Yeah, I'm not sure about them.
Well, yeah, there's a lot of biodegradable
cool.
options in
Yeah.
there. If you guys know anything about that, so are we saying that by eliminating these toxic products and by cutting back on your carbs for a period of time, that you can reverse your PCOS symptoms? What I'm telling you is that I coach people and they see that. And again, I shared that Michelle, I did a video with her testimony. She had been on metformin for 10 years, really bad cycles. And after 10 years, she got her lab back. Norwex.
Norwex.
Is that what I said?
Something like that.
Norwex.
Close enough.
Anyways, but Michelle was able to come off of metformin. And so your hormone problems aren't because you have a deficiency in a pill. Your hormone problem is caused by something. And what you want to do is you want to get down to the cause and not depend on medication, because then all you're doing is allowing your body to become dependent on those hormones and those medications. And during a time where like hormone-based cancers are rising in women, I mean, because of Angelina Jolie, people are cutting off their breasts, they're cutting out their ovaries and their uterus, and guess what? Breast cancer in the lymph nodes is now a thing.
Yeah.
So you've got to respond to the toxic hormone levels in our body.
Diagnosis or treatment. Seek a qualified healthcare professional before changing your health program.
Let's go faster.
Working on a new one. Visit us on Facebook and ask Drs. Warren for more information.
All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. I'm here with my wife, Dr. Rebecca Warren. And so tonight we've been going over testosterone issues, PCOS, and thyroid, right? So again, what do all those have, in connection? Why are we talking about all of those? Because these are the three most common hormone imbalances that we see that come into our office, and again, they have a lot of baggage with those, right? I can't tell you, I feel again, for some of the men that come in there with lower testosterone, because again, it's not them, right? It's they come in there kind of broken down, like, because they don't have the energy levels that they want. Sometimes they may be a little bit more moody. They may not be fun to be around. They're having things like issues with being able to have an intimacy with their wife, those type of things. And again, it can really drag you down quite a bit. But the good news is there's actual solutions to those problems, rather than just throwing a bunch of hormones into the body. And one of those things that I think you touched on, and I want to touch on it for a second, is looking at what are some of the best ways to actually tell if hormones are imbalanced, because it's not as simple as saying, okay, what is my free testosterone in my bloodstream, right? What is that? Again, what we like to look at is what are the processes leading up to making testosterone, or what are the processes leading up to estrogen usage, E1, E2, E3, things like progesterone, those type of things, DHEA, DHES. There's certain ways to actually look at that.
4-OHE1, 2-OHE1. These are all metabolites leading up to it. So there's different things that are going to affect that pathway.
No doubt. And one of the tests that we like to do in our office, and I think that's one of the best ways to do it, is is utilizing something called a Dutch test, right? And again, this Dutch test is actually a way that we can monitor those metabolites and actually monitor that process and see, what is the breakdown in that process.
I was going to say, if you guys go to our Facebook page, Doctors Warren, DRSWAREN, like it, I am going to post an example of what Dutch test results.
Yep.
And you'll understand why we know way more about your hormones than any of the doctors you've seen.
Yeah, well, I think the problem is that, some people may have ran a Dutch test in the past, but then you have to be able to break it down. And that's really where, we've done a lot of studying. We've actually really taken a deep dive in understanding, okay, what are the breakdowns in the process? What are the things that are going to actually help to support that end product, right? What is it going to take to actually, either speed up that E1 pathway or to reduce that E2 pathway or those type of things in order to what? In order to actually get the product at the end and do it in a natural and effective way.
And how about thyroid? Guys, a lot of the reasons why you guys are not doing well with your thyroid is twofold. I say this over and over again because it doesn't matter how much I say it, it's still happening. Number one, you're not getting the right labs.
Yeah.
If you go look at your labs, I bet you only have TSH and maybe free T4. You've got total T4. You're not even close. And so, you're not getting the right labs. And then the majority of the people that I see that have the right labs, they might have free T4, free T3. This bothers me. They'll have antibody numbers on there, but your practitioner doesn't know how to look at it correctly. And so you have antibody numbers in the hundreds, and they tell you everything is okay. Well, having high TPO antibodies or thyroglobulin antibodies means you're having an active autoimmune reaction in the body. And how could you possibly be well? What's going to happen is you're going to have high antibody numbers, and eventually you're going to need more Synthroid. And if you've been on Synthroid for a really, really long time and they haven't changed the dose, it doesn't mean that means you never needed a change. It means that you are feeling like crap and you don't even know it.
And they forgot about it.
You forgot what it feels like to feel well.
Again, most of the time, unfortunately, it doesn't mean that men don't have thyroid problems. Actually, a lot of men do have thyroid problems that their doctors just don't think to look at it. But I was actually sitting down with a first appointment with a man, mid-40s, and this was last week, and he was talking about how he feels like his thyroid hormone is off, but he's been on thyroid medication for over 20 years. I'm like, okay, when's the last time they ran your thyroid numbers?
Oh my gosh.
He's like, I don't know. It's like, I think it had to at least be 5 years. I'm like, wait, so you've been on this medication and they haven't even tested to see what your body is doing. In 5 years, they've just left you on this? And they're like, yeah, they just said since my weight is doing pretty good, I could just stay on this dosage. I'm like, oh my God, I guess maybe if that's all you focus on is weight, but how many skinny people do I know with cancer, right? It's the skinny man's disease. So bottom line is again, you have to figure out what is the right test, figure out, okay, now that I've gotten the right test, how do I interpret it the proper way, right? From a functional standpoint, instead of just looking at it from a medical standpoint, look at it from a functional standpoint, because we don't want just normal, right? Mm-hmm. We want optimal. If you want normal, again, normal in this country is what? It's getting sick. 5 out of 6 Americans with cancer or heart disease, it's diabetes rampant, it's life expectancy going down. That's normal.
6 million women are infertile and unable to get pregnant.
That's normal.
That's conservative, yeah.
So again, we want optimal, and that's what we want to look at when you come in. Same thing that that Dutch test that we talked about. Another fantastic way to look at men, right, and testosterone, and actually see some other things, because you know what a lot of people don't recognize? That you can actually have testosterone issues because you have an issue with melatonin and cortisol imbalance, right? Mm-hmm. And so, you men that again are working so stinking hard, right? You're working so hard, and you come home late at night, right? You're stressed out because the job was, very, very stressful. You haven't seen everybody, but when you come in, kids are yelling, going crazy. Again, you got that other stress, good stress, but you still have stress, and then you go to bed late because you just want maybe an hour just to zone out and watch
sound
TV
like you're
or
talking
something.
about your life.
I know, right? I've been stuck there though, and I think so many people listening to this can understand that. And then you wake up early because then you got to go back into work. You chug down, something that stimulates you just to get you going for that day, and so your circadian rhythm is off. And this doesn't just happen day after day. I'm talking about years, right? And years can throw off your cortisol, melatonin levels. Next thing you know, your testosterone tanks, right? It absolutely tanks. And so again, these are some things that we work with in our office.
And so I hope if you guys are listening to this, that number one, you go to our Facebook page, you follow it, look at our videos that we have there at Doctors Warren on Facebook. But I hope that you guys understand that we share all this information and we're striving to give you hope, to enrich your life, to empower you, to understand that, you can get to a point where you feel like this is as good as it's going to get. But the truth is, that's a lie. And the truth is, you haven't even come close to as good as you can get because you've never done any of these things that we've spent the last hour talking about. So I want you to have hope that, hey, if you haven't even done this, if you haven't even seen a functional practitioner like what we do in our clinic and how we coach people all over the U.S., if you're not eliminating these things, if you're not balancing out your good fats and learning how to heal your heart without needing statin medications, guys, then you should have some hope that there's so much more. There's so much potential, and that the only thing you have to do is just start today with the right decision. Whether that right decision is for you to, for you it's calling in and making an appointment to sit down with us. If that right decision for you is stepping out and trashing all your toxic hair products and then going tomorrow to Earth Fair to get healthy products, if it means getting rid of your canola and cooking with grass-fed butter, like whatever that first decision is for you, is you have to take it, because now that you've heard us speak, now you know better. Now you know it. You can't say, I never knew I could get better with my hormone issues, because we just told you that. And so for those of you guys that want that help, because I know that's hard. I had my thyroid taken out when I was 19, and so I was a 21-year-old going through hormone issues. We know it's hard. That's why we have that appointment time. We have one appointment left. You can give us a call. You can set that up here locally or virtual consult. Give Mary Beth a call. That number is 423-362-5360, 423-362-5360.
Yeah, and I wanted to give you guys a few things really quick before, I know we got a couple minutes left. Just some things that you can do right now, right? So number one, whether you're a man or a woman, I want you guys to start switching out the beauty products that you use at home. So start switching out, again, your shampoos, your soaps, your things like that. There you go, Skin Deep, right? Skin Deep, EWG, Environmental Working Group, and start finding out what are the non-toxic things. The second thing that I love, again, that really does a great job of hitting some of these pathways with hormones is sulforaphane, right? Sulforaphane is one of the active ingredients that's found in things like broccoli and other cruciferous vegetables. But again, in order for you to get at a high amount, in order for it to actually be absorbable and actually make a major difference in your hormones, again, you're probably going to want to get that from supplement form.
Stabilized
that's
supplement.
Right, stabilized supplement, sulforaphane. And then the third one that I'm a major fan of is actually utilizing something like exercise, right? Actually getting outside or getting to wherever you need to get to. Maybe it's at home, wherever it's at, and throughout the day, right? Get moving. We know that certain types of exercise will actually start to balance hormones and, again, make you sweat, which does what? Detoxifies the cell.
What type of exercise? Not just cardio.
Like more like high intensity, short duration, right?
Burst.
Yeah, burst training. Get your bang for your buck. So spend 15 minutes working really, really hard, and do that 3 or 4 times a week and actually start getting moving. Bonus tip: phosphatidylcholine. Dr. Rebecca can post that on our Amazon store. Again, it heals the cell membrane.
Amazon.com/shop/Doctors Warren. You can find all of our favorite supplements there.
Yep, absolutely. And again, guys, if you want to catch more of our past shows, Doctors Warren on Facebook. Join us again Saturday live from 10 to 11. This is Wellness Radio. We'll see you guys next week.
All right, guys, just make sure you guys share this video. If you're watching this and you have any questions for us, leave us a comment. And I think what we're going to try to do is I'm going to try to do another Facebook Live for you guys. I will schedule it so we can dive deeper.
Yeah, no doubt. And so, again, just as a quick repeat, sulforaphane. If you want to know the exact brand that we use, shoot us a message. You know, we can talk to you more about that. Again, we have a really high potency.
We'll do a video on it.
That'd be a good one to do, for sure. And again, making sure that you're using the right
Shea
stuff.
Moisture is my alternative to toxic shampoos
There
and
you
hair
go.
supply. I will
for
say,
it.
I need to get some more. That is
Yeah.
a good one for skin and hair. So that's really
Oh yeah,
awesome.
and again, that helps us support your microbiome on your skin too, which is important, right? We don't want to kill all the bacteria on our skin. We want to support those, and you know, shea butter is one of those that actually does support it. So well done. I'm super proud of you. Right? So again, guys, I hope you have a great night, and we'll see you guys soon.